The silent epidemic, recognizing when back pain signals trouble. Back pain is a universal human experience. Almost everyone will experience it at some point in their lives. Often it's a minor annoyance, a temporary consequence of overexertion or poor posture. But sometimes back pain can be a wolf in sheep's clothing, a silent indicator of a much more serious underlying condition. Learning to differentiate between ordinary back pain and something more sinister is crucial for ensuring timely intervention and preventing long-term damage. Most episodes of back pain are musculoskeletal in nature. This means they originate from the muscles, ligaments, and bones that make up our backs. Such pain tends to be localized, improving with rest and over-the-counter pain relievers. However, when back pain persists, intensifies, or is accompanied by other concerning symptoms, it's time to pay attention. Recognizing these red flags is the first step towards protecting your spinal health. Ignoring them can have serious, even life-altering consequences. In the next section, we'll delve deeper into the specific symptoms that warrant immediate medical attention. Red flags. Unmasking the symptoms of serious spinal issues. One of the most alarming symptoms associated with serious back pain is sciatica. Sciatica is characterized by pain that radiates from the lower back, through the buttock and down the back of the leg. This electric or shooting pain is caused by compression or irritation of the sciatic nerve, often due to a herniated disc or spinal stenosis, which is the narrowing of the spinal canal. Another red flag is the loss of bowel or bladder control, a sign of Kade T syndrome. This rare but serious condition occurs when the nerves at the end of the spinal cord are compressed, often by a large herniated disc. Kade T syndrome is a surgical emergency and requires immediate medical attention to prevent permanent neurological damage. Morning stiffness that is severe and persistent, particularly in the lower back, can be a sign of spinal arthritis. While not always a medical emergency, spinal arthritis can significantly impact mobility and quality of life. Early diagnosis and treatment are essential for managing pain and slowing the progression of the disease. These are just a few examples of the red flags that can accompany serious back pain. It's important to remember that any back pain that is severe, persistent, or accompanied by neurological symptoms should be evaluated by a healthcare professional. The urgency of action. Why immediate medical attention is critical. The human spine is a complex and delicate structure, responsible for supporting our bodies, protecting our spinal cord, and allowing for a wide range of movement. When something goes wrong within the spine, the consequences can be devastating. Ignoring the warning signs of a serious spinal problem can lead to chronic pain, permanent nerve damage, loss of mobility, and even paralysis. Seeking immediate medical attention when you experience red flag symptoms allows for prompt diagnosis and treatment. The earlier a spinal issue is identified, the better the chances of a positive outcome. Early intervention can prevent further damage and improve the effectiveness of treatment options, which can range from conservative measures like medication and physical therapy to more invasive procedures like surgery. Delaying medical attention, on the other hand, can have dire consequences. For example, a herniated disc that is left untreated can lead to permanent nerve damage and chronic pain. Similarly, delaying treatment for Kade T syndrome can result in permanent loss of bowel and bladder control, as well as paralysis. Safeguarding your spine. Preventive measures for a healthy back. While not all spinal problems are preventable, there are steps we can take to minimize our risk and maintain a healthy back. Regular exercise, particularly core strengthening exercises, helps to build a strong muscular support system for the spine. Maintaining a healthy weight reduces stress on the spinal structures, while good posture helps to distribute weight evenly across the spine. Ergonomics, the science of designing and arranging workspaces to optimize comfort and efficiency, plays a crucial role in preventing back pain. Using ergonomic chairs, adjusting computer monitors to eye level, and taking frequent breaks to move around can significantly reduce the risk of back strain and injury. Finally, it's essential to listen to our bodies and avoid activities that exacerbate back pain. Lifting heavy objects with proper form, avoiding prolonged periods of sitting, and practicing safe lifting techniques can all help to prevent spinal injuries.